Что он у меня? Блин, потому что видишь, потом так, ага. Потому что вид, я кликаю только что вот это, чтобы убрать от просто вид.
Хорошо. Так, woman's years, reproductive life. Start each woman from childhood has predisposition for growth and development. For sure, in that period, reproductive system is in sleeping regime, is not yet wake up, but if girl in a young age, in childhood, has one or another extragenital pathology or infections, for sure it's make the effect for future functions of reproductive system and for future manifestations and regulation of menstrual cycle. And when we have women of reproductive age, it's normally we ask from her about how is going on her childhood. In adolescent period, it's wake up and start already functioning, but in the beginning, it's yet not stable and quite common. We have disorder of menstrual cycle in two age period when it's not yet established. It means when menarche occurs, start regime of functioning of reproductive system, maturations, and it's not yet stable, so disorder of menstrual cycle is more common. And when cessation of reproductive function, it's advanced reproductive age after 36, 37, 40 years. In this period also menstrual cycle is not stable and is not regular. Reproductive age is the most important period for women when she already prepared to become a mother, and reproductions, each menstrual cycle is normally physiologically need be regular and need be ovulatory. So she is able to get baby. And slowly it's cessate in after reproduction age, as I told late reproductive age, after that premenopause and post-menopause. In each period we have one or another gynecological disorders, but it's for that we will touch upon more when we discuss gynecological cycle. It's 5th year, and you will come back for that things. Now about childhood. Woman is already get a special set number of eyesight, which she get even in her embryological life. In this case, taking this into consideration, we understand that for no number of follicle and anatomical and functional reproduction system is very important. How is going on maternal period during pregnancy? If mother, for example, this gestational age for 20 weeks, and for example, if mother of girl and 20 organ of female fetus. If spermatozoid for male is renewed after delivery boy, and starting reproductive functions for boy, it's renew each month. For woman, it's not like this. Woman, she has get number of oocytes, that's all. No more oocytes she will not get. And it's very important to understand, for example, in a majority of all religion and culture, very strict about behavior of women. For example, not normal if a woman smoke, but if men smoke, it's for sure we understand it's bad, but society and doctors is more tolerant for that situation. Why it's like this? Because a woman not get new oocytes. The set number she gets during fetal life, that's all. After that, she will only lose her oocyte. And the first very big cessation, decrease in number of follicles, is during delivery. When she is delivered, it's a severe stress for each fetus and for female also. A big number of follicle will decrease. After that, it will be a decline in the period of adolescence when she start menstruate first time, and when menarche, first menstruations is we call menarche. I hope you remember it's from practical class. And after that, each month when a dominate or Graafian follicle will growing, you remember I called dominate follicle queen of follicle, queen oocyte, and nearby of that will sacrifice their life a lot of follicles to around 20, 50 follicles will die to support life of this queen, which will grow till size when ovulation is possible. So also lost of a number of oocytes. In menopause, we have physiological cessations of number of follicles, and if we compare woman ultrasound, for example, in premenopause, we can see only few follicles compared with ovary, which is typical for adolescents girl, where we have a lot of number of follicles which we're able to visualize on ultrasound. Hormones also will demonstrate these things, and according number of FSD, FSH and LH, we can see that if it's rising in blood, these hormones, we can predict beginning of cessation of follicle. Another laboratory investigation which are able to find how much follicles in ovary, it's we have another laboratory investigation which can help us with laboratory investigation plus ultrasound examination, help us to check how enough or not enough number of follicles. Another laboratory criteria is anti-Muellerov hormone. Так. Menarche and menopause, it's two physiological point. Why point? It's not long period, because menarche it's point, day, moment when menstruation starts. Menarche we call first menstruations. According that, we can say that we have minimum age when menarche is able to start and maximum. But also very important to understand average age. Average age of menarche now around 12 years, but minimum when it can start 8, maximum 16. If girl came, mother with girl came and says that she is 7 years old and start menstruate, it's already not normal. We need screen her for pathological situations, and it's abnormal puberty. And the same, if girl in 16 years not yet menstruate, we also need to investigate such girl for the reason of possible pathology. But if she came, for example, in 15 years, and because all her friends already start menstruate in 12 years, it doesn't mean that she has pathology. We, according different situations, can make conclusion, is it necessary more deeper investigations or not? And more deeper investigations we can suggest for woman, for a girl who has deviation, for example, in growth, or who has another stigma of, for example, Turner syndrome. So if we find one or another findings, if you have, if girl has another findings, clinical and physical, which help us suggest some pathology. If she say that, for example, her mother her mother will say, because mother usually bring girl for the doctor, say that she herself starts menstruate in 16 years old, and we didn't find any problems with her height and other physical abnormalities, we can say for mother that it's physiological and not necessary worried about that before 16 years. Menopause also has average years and also has minimum and maximum. From 45 to 55, it's range of beginning and finish, minimum and maximum, but average is 50 years old. These days, more frequent we have that patients has or stations of menstruations more earlier. And in my practice, quite common, I have such patients who already stop menstruate in 45 and in 47 years. Yes, it's normal, but the tendency is that more we have for closer for low margin of menopause. And in these patients, also possible one or other predisposing factors. If it started earlier than 45 years, we can say it's premature or early menopause, and such patient is in the risk of some or other complications, which we will discuss during additional topic menopause. And in puberty, we use special events which occur gradually one by one, and it includes bulging of breast, growth of pubic hair, spot peak of growth, and growth of axillary or pubical hair, and we have for sure the most important is beginning of menstruations. Like finally we have that. And according we have special scale which is known like system estimations for puberty scale, Tanner system or Tanner scale, which estimate normal degree or normal degree according to the age when development of breast or sexual hair, because axillary and pubical hair, we call it a special name, sexual hair. Students, I see that you switch off your camera. You remember that I request you, everybody, to on your camera. It's for everybody. I want to see that you present, хотя бы physically, maybe not mentally, not physically, you are here. Who is not here, please monitor, call for them and remind.
Yes, ma'am.
But Barat, where you are, only your photo. So I'm
here, ma'am.
Not necessarily sleep. I understood that you're already sleeping, but my lecture is not lullaby for you.
No, ma'am.
Да. Changing in this according the age. You see that according events first, what is started from age is grow. It's not menstruation. Some think that maybe it's growth of hair or might be it's menstruation. It's not correct. First is bulging of breast. each has special terminology. I remind for you that is very important. You are not housewife, you are doctors, future doctors, and you need to know. Barat, again, switch off camera. Что такое? What's happened?
Internet problem, madam.
Internet problem. Так, each has special terminology. Growth of breast we call telarche. Growth of pubic here we adrenarche is growth of axillary. Pubarche, growth of pubic hair. Menarche, first menstruations. Please, when you during practical classes, you need to use this terminology as a doctor. Now, this stage you can make a photo from my slide, or you will find it in the internet. It's not a big problem. I think all books has this. And it's this scale for sure used not only for female or for male, also adequate or not adequate development, and calculate how is according to the age. Tanner scale. Now, more close, we discuss physiology of regulation of menstrual cycle. I don't know why, but we have different levels of regulations. In your book, it's not very detailed given, so when you use only your book, you're not able correctly answer for my questions during practical class. We have level of regulations and we have target organ. Uterus with endometry is target organ, it's not regulations, it's regulated. For sure, we have another organs, target organs, and very close for reproductive system, it's breast, breast and uterus. If we have one more, if we have pathology of a menstrual cycle and we have pathology, for example, in uterus, quite common. Also, smart gynecologist, if do examination, is able to find pathology in breast too, because they undergo disorder of hormonal effect, both because simultaneously because they are target organ. Another situation which is not very good given in your books, that level of regulation commonly answer for me that it's hypothalamus. Hypothalamus for sure is included, but it's only second level of regulation. Additionally, we have cortex in your books. Unfortunately, it's not. But we know such situations that disorder of menstrual cycle, and which we call absence of menorrhea, for example, amenorrhea occur after, or another disorder, not obligatory amenorrhea, occur after severe stress. It's proof for us theory that regulation started even from cortex. Also, we had such phenomenon, such terminology when I was a student, doctor who analyze gynecological disorders during Great Patriotic War. They find that woman is during period of the war had disorder of menstruation and very common amenorrhea, and get such term war amenorrhea. But when I live in my student and young age doctors working period, I think that it's only historical moment, and I think that in my practice I never met this problem. But unfortunately, you know in which period we live now, and now more and more common I have such patients who has a disorder of menstrual cycle and amenorrhea also as a result of living in stress conditions, living in war period. It's now become more frequent. Так, for hypothalamus second level, production of releasing hormone, what produce cortex? It's opioid, different opioid, which can regulate level which is below. Each level which is above is control level which is below. I hope you understand this. And gonadotropins plus, I am sure that you all these things study when you study physiology, physiology in previous department. Gonadotropins regulate anterior pituitary, and the most common hormones which control menstrual cycle, for sure, it's FSH and LH, but it's not only one hormone. We have a lot of hormones which participate, maybe not so active, but also participate in regulation of menstrual cycle. Somebody might can say for me, what is this hormone in anterior pituitary? Who remember? Nobody remember.
Prolactin.
Prolactin, yes. What, for example, prolactin also. And we know, for example, after delivery, woman has increased level of prolactin because of lactation. And in that period, she has physiological amenorrhea, which we call lactating amenorrhea. In this case, it's okay. But if a woman is not breastfeeding, if she is not lactating, but because of another pathological situation, increased prolactin, she might have disorder of menstrual cycle and amenorrhea also. No, for that detailed things, you will study more on gynecology when we will discuss gynecological disorder. Menstrual cycle is basis. If you don't know physiology of menstrual cycle, according to my opinion, you don't know no obstetrics, no gynecology. But please be very attentive and especially for this topic. FSH and LH regulate growth of follicle in next ovary, level ovary. And when FSH level increase, it stimulates growth follicle, and from small follicle it grows to big size, which we call Graafian follicle or dominate follicle, and it's already able to ovulate. Ovulation is occur at the increasing level. Not only FSH are very important for ovulation, LH hormone. Have a look. Ovary is next level. So in ovary is produced hormone estrogen and progesterone. Estrogen produced mainly by growing follicle, and the more growth size of follicle, the more estrogen is produced. You see, the maximum level of estrogen is just before ovulation. And progesterone is produced by corpus luteum, and you see, it's also need time to reach peak and maximum level. And if we compare with day of menstrual cycle, maximum level of progesterone we have on which day? Have a look on picture. Which day reach maximum? Progesterone. Compare day of cycle and level of progesterone. It's visible.
It will be 20 to 26.
23.
23rd day. For which reason we need to understand this? Because if we are going to investigate hormones, we need to understand when to prescribe it for patients. And this period is the best to check level of progesterone. Here I refresh for you another hormones which produced in anterior pituitary. One you memorize yourself, it's prolactin. But very important for us also thyroid stimulating hormone and function of thyroid glands. Disorder of this function of thyroid glands doesn't matter, hypofunction or hyperfunctions is make disorder for regulations of menstrual cycle. And you can see here that in posterior pituitary we have hormone oxytocin, but it's not produced in posterior pituitary. Here I want to remind for you that it's only collecting, and it's important for what oxytocin?
Contraction of the
Contraction of uterus.
We study with you labor physiology. For normal menstrual cycle, oxytocin is important or not? No? Any suggestions? Так, ладно, will answer for me later when check. Так, axis. You see each axis and the regulations from hypothalamus. I told gonadotropin releasing hormones produced. After that, secreting transported in pituitary glands below, and functions of hormone releasing stimulate synthesis of LH and FSH. FSH and LH has the common name. You need also know this terminology. Gonadotropins. If we told gonadotropins, it's what does it mean? It means that we talk about FSH and LH. It's common name for these two hormones. Steroid which produced in ovary, we talked already that it's estrogen, but you have to understand that all steroid start synthesized from cholesterol. You see above, that is cholesterol. It's like glue from which all other hormones steroid will create. And which steroid we know? We told estrogen and progesterone, but it's not only one, for sure, it's dominate. Usually it's not included on this scheme of menstrual cycle that we have androgen, but you need to remember that androgen also produced in ovary. For sure, if we talk about female patients, it's not so much. But if we have disorder of menstrual cycle and some disease, like for example, PCOS, which you will study on 5th year, it's associated with abnormal functions of ovarian control, ovary, and its increased productions of androgen in such patients. It can be visualized even clinically or laboratory we can, but a typical mistake of students that you gave me only two hormones, estrogen and progesterone. Normally we have three: estrogen, progesterone, and androgen, which is produced in female gonad. What is female gonad? Who can say name of female gonad? You see here, gonads. What is female gonad?
Ovary.
Ovary. Why confusing? Ovary, for sure. A male gonad. What is male gonad?
Testis.
Testis. Вот. Ovary and testis is gonad. Значит, female gonad ovary produce three hormones, dominate estrogen. If ovulatory menstrual cycle, after ovulation, production of progesterone, but some student has mistake. They think that in first phase we have only estrogen. In second phase, we have progesterone. Pay attention again to this slide. In both phase, we have both hormones, estrogen and progesterone is present. But in first phase, estrogen more, and when it's peak, it's just before ovulations. 12, 14 days. Progesterone and estrogen both present in second phase too, but level of progesterone is bigger compared with level of estrogen. Because sometimes I hear that students think like this: estrogen in first phase, progesterone in second phase. It's not like this. Normally, it's as I explained for you. Plus, additionally, in small amount, female has androgen. Feedback. You also study this in physiology, but sometimes and make for you confusions. We have direct and backward chain for answer, and we have positive and negative effect. For example, level of estrogen increase level of LH and VSH. Это positive feedback. Допустим, negative feedback increase progesterone level of LH decrease. After ovulations, we know that in LH and FSH will be decline and come back in beginning of menstrual cycle, come back for the basic level. Decrease of estrogen, we have increase of follicle stimulating hormone. But according to this phenomenon, we even detect beginning of menopause, because we are not sure. Maybe age like 45 or 47, but we don't know, is it menopause or maybe she, as a result of stress, has disorder of menstrual cycle. If it's real menopause associated with declining of follicles, level of estrogen also will be less, and in that case, send for stimul to say, okay, we need wake up ovary to brain pituitary increase level of FSH, which drive wake up ovary. But if no follicles, we're not able to wake up if nothing, inside, nothing. And in this case, how doctors use it practically. I want that you understand not only theoretically how it works, how we can use it practically. But we can check level of FSH in blood, and if level of FSH bigger than normal, we can suggest that patient has a diminishing of follicle. If it's associated with late reproductive age, it's probably menopause. But for example, patient can have radiological effect because, for example, she gets some medications according to the cancer in another location, but the radiation can affect diminished number of oocytes in follicle too. If we have long chain, what is long chain? The increased estrogen and decreased hormone releasing. It says that not necessary already stimulate ovary. We have more than enough estrogen. And you see here only one, we have androgen level at the ultra short chain. Then more level of androgen, because they are antagonists. You understand what mean antagonism term, when they work opposite. When increase level of androgen, estrogen for sure will decline. So in different practical things, we also able to use this chain. Так, гипоталамус, releasing гормон, дальше идет FSH, LH. FSH stimulate maturation of primary oocyte, in immature follicles. Follicles start produce estrogen, and estrogen start increase number of estrogen effect for target organ. Target organ is uterus. So starting growth of endometrium. Under effect of estrogen, what is occur? Occur growth of endometrium. I want that you also understand after ovulations. Corpus luteum, we told, produce progesterone. On the 15-16 day inhibits by LH inhibits. And how it's occur? If is pregnancy happened, if happened, corpus yellow still mature and produce progesterone. It's first endocrine system of future pregnancy. It needs support development and growth of pregnancy before placenta established. After placenta start functioning, already yellow body is not necessary and it start regress and change for corpus albicans. But the same events occur if pregnancy not happened. Yellow body formed, menstruations not, pregnancy not happened, menstruation started. What happened with the yellow body? Yellow body undergo atrophic changing, and as a result of that occur white body. Progesterone effect for endometrium, and it's create changing which we call secretorial changing. Jumping. You can see it's how it's changed during cycle. And progesterone and estrogen also for endometrium effect changing in vessels of that. Here you can see how happened productions and changing of hormones in ovary, in follicles. Even in ovary we have different cells. Например, follicles produce, we have granulosa cells and teca cells. In granulosa cells produce which hormone? Who knows? Алло, granulosa cells.
Is it estrogen?
Estrogen, yes. The same follicles, is the same ovary, but different cells produce different hormones. In teca cells, teca cells produce androgens. Where these androgens can be able to transform to estrogens. We have another endocrine tissue which is not included in menstrual cycle directly, but it's very important. It's fat tissue. Fat tissue is like factory which make transformations of one hormone to another. And because of that, if a patient has a deficiency of weight or overweight, we quite common have disorder of menstrual cycle. You need to understand this. Levels of estrogen and progesterone is high in the end of menstrual cycle if pregnancy occurs, and it starts gradually increase. We talk about this when we discuss with you topic normal physiological changing. And additionally, will, as endocrine functions, increase level of human chorionic gonadotropin. If patient not pregnant, human chorionic gonadotropin is not present. level of estrogen or progesterone. If pregnancy not occur, decline. If pregnancy occur, it start rise like on this picture. The end of reproductive age of woman, hormones decline. All hormones decline, but for sure, first hormone which is disappeared from reproductive function is progesterone, because in this period, woman already not ovulating, estrogen still produced. In premenopausal period, we have such things that a woman has increasing of estrogen and decreasing or absence of progesterone. Androgen still is the same level, not change. But with the time, when all follicles die, no estrogen too. It starts declining level of estrogen. But if we check in blood, we still is able to find some estrogen level. From where this estrogen? Who is able to answer? Questions for logical thinking, taking into consideration my previous explanation. So nobody listen attentively. Just few minutes ago, I told for you about endocrine organs, fat tissue, and I told that if androgen is able to transform in estrogen, it's good for me that you're not listening me at all. You would speak on camera and doing something else. So no estrogen from follicles, because no follicles, all follicles die in ovary. Ovary is empty. But estrogen, woman in postmenopause period still has an amount of estrogen, and this estrogen is transformed from androgen. But when patient very old, already 70 years and more, even have declining of androgen too. And in this case, late postmenopausal complications, you may be heard about this, very serious complication, osteoporosis, because androgen give for bones a strong structure, and in this period bones become very fragile and it's risky for trauma. Very important moment for which I want pay your attention, it's number of days and length of menstrual cycle. Normal durations of cycle has the same minimum and maximum, and still it's normal. It's not to this, but outside, and as the answer I get 5 days for such things, I won't put for you 0 level. I can understand, I can expect that patients not understand this, but you also, but if students and doctor not understand this, it's already big problem. If you ask patient, communicate with patient during practical period, and you ask how long your menstrual cycle, and patient gave for you by mistake, because she not able to understand this difference, she said for you 5 days. Unit gave for her some help. You can ask how many days you have from first day of one menstruation and first day of another menstruation, that she is understand what you're talking about. But for students, you need very exactly understand the difference. Menstruations and menstrual cycle, it's two different things. About Follicular phase. Pay attention. Follicular phase, according to the length of menstrual cycle, has different variation according number of days. 7, 15, 20, etc. But second phase or luteal phase is still stable and it's always 14 days. According that, we need to understand that ovulations in each site has different time to occur. That if patient who has 21 days, she might be ovulate on 7 days. Patient has 34 days of cycle, she will ovulate only on 20 days. And if we talk about, we have more common normal menstrual, both all this cycle is normal, understand, normal. But more typical menstrual cycle when we have 28, 29 days. In this case, ovulation is on the 14th day. Is it clear for you? Ой, что такое вот
Yes, ma'am.
that
Yes.
is from that. Ну, уже и our time, да, is over. Time is over, да?
Yes, ma'am.
Вот, значит, пожалуйста, please take this information into considerations and use it in your practical class. What else I want to say for you as my recommendations, and it's typical mistake about menstrual cycle which students is performed. We have at the same time two menstrual cycles. Yes, it's one patient, one cycle, one menstrual cycle, but it's according organs divided. We have ovarian cycle and we have uterine cycle. In your book is given Russian salad always together and as like this you gave for me not correct information. So I request you to understand how we call this phase of menstrual cycle. If we talk about ovarian cycle, we have three phases in ovarian cycle. Follicular, in this case, follicle is growth. Ovulation is like moment, it's not maybe exactly phase, but it's border between one and another phase. You know, in ovarian cycle, we can find three or two phases, follicular and luteal, and ovulation, it's in between. So ovarian cycle, follicular phase, ovulations, luteal phase. If I ask, please give for me phase of uterine cycle. First phase is also quite common, I hear mistake. You say menstruation. It's not very accurate. Menstruation, the clinical events which occur during this phase. Yes, it's bleeding, and it's usually around 5 days, 1 to 5 days normally, but normal, it's not present in your book, so I gave for you, please write it and make tattoo on your forehead. We call it desquamation phase, desquamation, because it's histological events. After that occur regenerations, and we call proliferation phase. Till middle of cycle, till 14 days, we have proliferation. Proliferation phase, we able to divide for early and late. After ovulations, happens secretorial changing in endometrium. So we divide for secretorial phase, which also possible divide for early and late. So if I ask, gave for me phase for uterine cycle, you need to say for me desquamations, early proliferative phase, late proliferative phase, early secretorial phase, late secretorial phase. Understand the difference? 3 phase in ovarian cell, 5 phase in uterine cell. And please not make changing. Because when I ask you students, please give for me name for me a phase of ovarian cell. And you say for me menstruations. First of all, menstruation is not phase, it's clinical. Second, it's occur in uterus, not in ovary. Understood? Or if I ask you, gave for me uterine side, or you gave for me ovulations, it's also not correct. Because ovulations, it occur in another organ, not in uterus, in ovary. It's two different organs. Yes, these events occur simultaneously, parallel with each other, but it's like sky and earth. Understood? Do you have questions for me according to this topic?
No, ma'am.
No, ma'am.
Nobody. What's when you don't have questions? All clear, everything or nothing? According you, probably nothing, да? Like this? So, okay. Have a nice day.
Madam, I want to ask when could I come to give you the list, the lecture list?
List of lecture. No, we have more lecture or not?
No, ma'am, today is the last lecture.
Today last lecture. You can come for Madame Sharif, huh?
Okay, ma'am.
Or you can contact with her on Monday or tomorrow. She is on